in medical rounds, helping aging parents. The holidays are a time when families get together. Many adult children return home after several months to see if their elderly parents need more help than they thought. But a program at Hartford Healthcare may be the answer. Karen Pagliaro is the Director of Government and Community Relations at Harford Healthcare at Home. And Karen, thanks so much for joining us tonight.
Thank you for having me. Thank you.
So first off, if you're in a situation where your parents still want to live on their own, what can you do?
Well, I think that truly knowledge is key. You really have to look at what your parents need in the home, and then it could be very simple. It could be getting somebody to come in and help with errands or shopping or meals. There's many different private duty agencies out there, such as our agency, Independence at Home. But you really need to make an informed decision. Then, if there's a medical setback, you can have a certified home health agency come in and provide care, which is typically under a physician's order and covered by insurance. And we have an agency that provides that type of care too, Harford Healthcare at Home.
And how do you come up with a custom plan for your parents? What really goes into that?
Well, with that, you really need to look at your parent as a whole. And what you have to do is make goals that are both achievable and reasonable. And then they really need to look at both medical needs and then needs of activities of daily living, such as eating, bathing, and grooming.
And lastly, if you're not sure if your mom or dad needs help, what do you do then?
Luckily, Harford Healthcare has a lot of options for you. One of them is the Center for Healthy Aging, and this program could provide for an assessment in the person's home so that they can look at what the person's needs are. Their goal is always to enhance a person's life and keep them at home safe. And then Harford Healthcare at Home has care transitions. This program, we're able to provide a nurse to come out free so that they are able to do an assessment again in the client's home and then make recommendations and make referrals so that again the person is safely cared for within their home.
All right, some great insight there, Karen. Thank you so much for being with us tonight. We appreciate it.